For the best results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. The kids are back in school, but it's not too late to make sure that they're staying healthy and getting them the resources that they need, not only to make good grades, but to live a healthy lifestyle. Joining us first up is Dr. Linda Kiefer, a primary care physician with our St. Tammany Physicians Network Mandeville office. Dr. Kiefer, thanks for being here so much.
Well, you're welcome. Thanks for having me.
Tell me a little bit about your practice with the Mandeville office.
Well, I'm board certified in both internal medicine and pediatrics, and so I see patients from birth. I have some patients that are actually in their 90s, almost a couple over 100. So we see the whole spectrum, and we also have some an internist in the office, and we have several family medicine who also do a wide range of ages. Yes.
So a great place for kids too to get
absolutely.
started off on the right foot.
Mm-hmm.
Since we're back in school, hopefully some of this has already been taken care of by the parents and the teachers, but it's definitely worth reinforcing. One of the things you want to talk about was medications for kids that need medication at school, whether it's an inhaler or an EpiPen or allergy medicine, whatever. What's the importance of making sure that you're communicating that to the school? Pretty much most schools will not allow children to have their own medicines or take their own medicines unless they do have a specific permission form that's filled out and signed by their physician, their treating physician. Mm-hmm. And also, even though it may be something such as taking an Advil for a headache or for menstrual cramps in young ladies, generally they need to have a label placed on the bottle by the pharmacist that gives the exact directions as well. And is that a standard thing, or I mean, hopefully
pretty much.
A pharmacist
That's
would
pretty
do that.
much. Yes, they usually will. You purchase it over the counter and you bring it to them and generally they will put the instructions on when they see the form with the directions written on it by the physician.
Right, and we don't always have a school nurse around, so
yes.
It's really important to make sure that you are giving it to the school secretary, the administrative office, instead of letting your kid kind of go off on their own.
Yes, and generally I recommend they can actually ask their physicians for that prior to the start of school, mm-hmm. which will eliminate crunch time.
Right. Well, talking about performance in school, we talk a lot about how important sleep is.
Yes.
Now, the past 10 or so years, you've had this influx of electronic devices, iPads, iPhones, handheld video games, and whatnot. That's kind of a growing concern for a physician because you see the bad effects of what that's bringing in. What are some of the pitfalls of letting them use so much electronic media?
Well, there are several for parents to be concerned about, and it keeps expanding what we have access to on those devices, including being able to watch movies, sports games over again, but they have access to any number of sites that may harbor ill intentions towards
right.
children, basically. In addition, there are a lot of problems with having interrupted sleep or poor sleep patterns,
right.
and which can contribute definitely to the health of the child and to how well they may do in school. Mm-hmm. There have been some interesting studies showing that just the light source that's on the devices, even during early school, evening hours when people may be doing their homework mm-hmm. or communicating on their playtime, can contribute to delay in the onset of sleep. And so they do have programs available now that are free on the internet. One is f.lux.com
which will actually adjust for your area code for onset of sunset and sunrise, and change the coloring on the brightness on your devices so that you actually can have more natural types, evening lamp type lighting, which will not disturb your circadian rhythm for sleep. And I do recommend people at least implement that.
I'll have to check that out for myself.
Yes, I have it on mine at home, yeah.
You know, that it is a growing concern because schools are starting to do more online. They're sending students online. Diagnosis or things, signs and symptoms, and how to overcome it.
Yes, I do want to start by saying that there are definitely true cases of ADD and ADHD, and that it's perfectly reasonable to treat patients who have that, and it is helpful for them to have that treated. But sometimes just some of the same signs we get in children can be due either to inappropriate diet, but also to inadequate sleep.
Right.
And disruptive sleep patterns. They've done some studies with sleep disturbances in children not getting enough sleep, which is frequently the situation these days. And they will often have mood swings, have difficulty retaining memories, have difficulty with focusing and paying attention, having more impulsivity. And these are all classic signs of possible ADD or ADHD, but they may simply be that they're not getting adequate sleep.
So medication isn't always the first answer. You know, in our first back to school show that we did last month, we were talking about the importance of a healthy diet, you know, proper nutrition, proper, you know, meal times and whatnot. And then we did a whole segment on proper sleep techniques and, you know, when to put the devices away and whatnot. So don't always jump to medication with ADHD and ADD is what you're saying.
Not immediately, yes. They should be thoroughly evaluated, and these other areas of their lifestyle should be explored as well.
And that kind of rolls into the fourth point that we wanted to talk about, which is the importance of getting an annual exam for students. You know, there's always immunizations and whatnot that they need to get back into school every August, but the importance of the physical, actually checking to make sure everything is good, whether they're an athlete or not. Yes. There are inherent values to it.
Yes, and nowadays we're trying to really focus attention on the overall health of the child. And in not only do we do a physical exam, but we try to get a decent history from the parents. We try to examine patterns of their eating, of exercise, which is really important and often isn't occurring as much, especially with electronic devices and more things getting their attention during the day. Also sleep patterns, how they do in school, how they do in their other relationships. And the goal is really just simply to help guide. We realize there's a variety of family cultures and customs, and we're not trying to make everybody the same, but there are usually ways that we can actually work with the family and with the parents to optimize their children's health.
Right. It really kind of goes back to that whole, I say buzzword for lack of better terms, but preventative care is the new thing nowadays. Yeah. And if we can
for some of us, it's always been the thing, but yes.
If we can catch it young, you know, with obesity issues, childhood obesity and whatnot, sleeping patterns, just meeting with your physician, even on an annual basis, will kind of keep them right on the right track.
Yes.
So, well, Dr. Kiefer, thanks so much. I appreciate it.
You're welcome.
You know, we're talking about physicals, and when we return, we'll be talking about living for birth screenings and how to keep your child heart healthy.
Which flavor? There's no right or wrong answer. The options are endless and can be as unique as our personalities, be it young or not so young. And when it comes to your family's primary care doctor, we believe you should have plenty of choices too. Exceptional care, custom made for you. Because living here means getting condensed milk every once in a while. St. Tammany Parish Hospital, a world-class physicians network close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. The kids are back in school, and it's not too late to continue getting prepared for the upcoming school year. Dr. Kiefer was just speaking a lot about how important it is to get physicals on your children and make sure that they're in tip-top shape. kind of piggybacking on that, we're going to be talking about Living for Burke screenings. And to do that is Kristen Simpson, who's one of the founders of the Living for Burke Foundation. Thanks for joining us, Kristen.
Oh, thank you so much for having me.
Living for Burke, tell us a little bit about exactly what that foundation is and why it was started.
Living for Burke is a foundation that we started in memory of my nephew, Burke Cobb. He actually passed away at the age of 14, July 19th of 2012, while playing a pickup game of basketball at his high school. He was an incoming freshman. After his death, we learned that the cause of death was actually a sudden cardiac arrest due to a common symptom known to cause death in athletes, which is called hypertrophic cardiomyopathy. So he basically had an enlarged heart. And upon learning the diagnosis or the cause of his death, we felt so compelled, once we learned how prevalent it was, much more prevalent than we ever imagined, we decided that it was really important for us to make others aware of the risk associated with sudden cardiac death in youth.
And it's called sudden for a reason, because unless you have a screening, you're not going to find out probably until it's too late.
Most of the time, the children do not have symptoms, or if they do, they're just not aware enough of their bodies to realize that something's not, maybe it's normal for them. So they're not aware enough to understand that it's not normal. Things like shortness of breath or extreme fatigue, a racing heart, things like that. If they would have a symptom, and fainting is also one. So if they had some of those symptoms, those would be key symptoms to look for as a possible predictor of a cardiac problem.
Well, talk a little bit about the screenings that we offer at St. Tammany Parish Hospital. We are a site that offers those screenings. Tell me a little bit about the cost and what comes with the screening and the value of it.
We are so excited that St. Tammany Parish Hospital partnered with us. I approached them shortly after Burke's death, and they immediately wanted to get on board with the project. They are the first hospital in the state to offer a permanent preventative heart screening for athletes, and it's for kids ages 12 to 22, and it provides an EKG, an echo, which is an ultrasound of the heart, and also a blood pressure check, and they're all read by a cardiologist. They are by appointment, so you can just call the outpatient pavilion and schedule an appointment for your child. I believe that number is 871-5665, and the cost is $150. It does not require doctor's orders or insurance.
And it's important too, not just for athletes. I mean, we love football over here, we love soccer, our kids are out there all the time, but it's really good for any child.
We feel that every child is an athlete. So while we say student athletes, really I don't know a child that's not an athlete. They all run, they all swim, they all jump, they all play. So I think if you have a child within that age range, I would highly recommend that you get them tested.
Right, and it's not too late. I mean, they've probably already been in practice for the upcoming fall season, but it's never too late to get out there and get that screening.
No, absolutely not. I think it's well worth the $150. I mean, what do parents spend on a good pair of shoes, a bat, lacrosse equipment? I mean, for $150 to know that your child's heart is safe to play sports is really, you can't even put a value on that, in my opinion.
And it is something that we have seen on the North Shore throughout the parish. Sudden cardiac arrest cases have happened, and they will continue to happen.
We have. We've lost a child as young as 12 in Covington several years ago. And his mom and ABR started a foundation to put AEDs in schools. So we have seen it, we have been affected by it, and what our goal is awareness and prevention to prevent this from happening to another family in our community, because it is devastating when it does happen.
Right. What would you tell a parent who's kind of on the fence or is like, I don't really want to spend $150? You know, what kind of conversations have you had?
Well, I think that what parents don't understand is that they may think, oh, my child is healthy, we don't have any heart history of this in our family. And I would just tell them that we didn't either. I mean, Burke had, like I said, hypertrophic cardiomyopathy. What people may not understand is 1 in 500 people have HCM. That's, you know, across the United States, kids, adults, 1 in 500. So if you look at the population of a high school, 1 in 500 kids has what Burke had. It does not mean it will lead to their death necessarily, but it does mean that it's that prevalent. We lose up to 10,000 children a year. That's 28 a day. That's 1 per hour. You know, it's much more prevalent than we realized. And so why take a chance when there is a screening that's affordable and that you can have that peace of mind to know. And we don't recommend that you just do it once. We recommend twice, like every 2 years while they're in puberty, because that's generally when those rapid changes happen and the growth, the rapid growth during puberty. So we recommend preferably 2 times, like 2 years apart while they're in puberty.
Right, and you said that this is a statewide program. So about how many kids have been screened during the life of the foundation?
Since Burke's death, we've screened over 700 kids, and we have many more screenings planned in the upcoming months. And we also have some additional partnerships with hospitals we're working on in different parts of the state. We want this to be available, or as available as possible, to the community at large, and we want it to be affordable.
Right.
So that's really our goal, is to have a place for children to go if their parents want to have them screened.
And so again, St. Tammany Parish Hospital Outpatient Pavilion, we're showing some information again on the facts and what you need to know to get that screening done. About how long does that screening take?
Generally about 10 to 15 minutes. I mean, you come in, you fill out the paperwork, and you go right into the room. It's very fast, and then you get the results, I would say, within a week. And obviously, I think if there was something, if they found something abnormal, you would hear from them sooner. But
Right.
generally, a normal letter would go out within about a week.
Right, and this is, we were talking earlier, you know, this is not something that just affects children. We're focusing on that as we go back to school, but it's something that can affect any age range.
It can, and I think whenever we screen these adolescents, we actually can prevent deaths in young adults. So they may have a condition that's present during adolescence, but if they're not screened and it's not detected, they could die in their 20s, 30s, 40s of a condition that maybe perhaps could have been caught in the teenage years.
Right, right, and that's, you know, they're probably the most active at that age, which is a good sign. But again, it's for anybody. It's like you were saying, every student is an athlete. They're doing some kind of activity, so we can't stress the importance of getting these screenings enough. What else maybe that we've missed about the foundation and the screenings that we would want everybody to know about?
Well, one thing that I'd want to, just the information I'd want to put out there, something that I didn't realize, I had no idea that sudden cardiac arrest is the #1 cause of death on school property. And that's something that I think principals, administrators, coaches would be interested in learning, that one child dies every 2.5 days playing organized sports. I mean, these are just statistics that we had absolutely no idea. And so the awareness for us is so important. So I think if someone's hearing this, if they're flipping through the channels and are catching our show, I think that it's for everything happens for a reason, and I think they should heed the warning and just the information. And if they have children that they love and care about, or if they're a teacher or a coach, they would encourage these children to get tested.
Right. We talk about it a lot on our shows about early detection for cancer screenings and lung cancer screenings and whatnot. This is just one of those other screenings, especially for children, that should be a high priority. So
we would love to see this ultimately be a part of pre-participation physicals. Burke had many physicals. He was a 4-sport athlete. He had passed his physical 3 months prior to his death with flying colors. Pre-participation physicals miss about 96% of heart abnormalities. They're just not designed to pick up these abnormalities that obviously you need a more sophisticated test. So ultimately, we would like to see it as just a regular part of a pre-participation physical. So that's one of our goals as a foundation.
Well, Kristen, I appreciate it. Thanks for being here today. For more information, you know, people can always check Living for Burke's website, St. Tammany Parish Hospital website. But thanks again. We appreciate it.
Thank you so much for the opportunity to spread the message of prevention and awareness.
Good deal. When we return, we'll be talking more about what the Community Wellness Center at St. Tammany Parish Hospital can do to keep your child healthy throughout the year.
They're the movers and the shakers. They're the ones who change our world. And they deserve places designed especially for them, built with kids' specific needs in mind. The latest technology in the caring hands of our dedicated pediatric specialists and primary care physicians, helping kids feel like kids. St. Tammany Parish Hospital, world-class health care for children close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. The kids are back in school, and we're making sure that you are on the same page as your kids and keeping them on a healthy lifestyle track. One of the things that we do want to talk about, we talk about it quite often, is nutrition, and with that comes some concerns with obesity. To discuss some of the issues that come with obesity, we have Sharon Novak, who works with our WIC program and is a registered nurse with the St. Tammany Parish Hospital Community Wellness Center. Sharon, thanks for being here.
Thank you. Thanks for having me.
Quite a mouthful. One of the big things I know that you work with parents and young children at the Community Wellness Center is obesity and some of the issues that come with obesity, and not just the health concerns that are associated.
Correct. We do a lot of education on starting at a very young age, promoting parents' involvement in getting their children involved in a healthier lifestyle and having the parents set the example for the children.
You know, obesity is a concern, especially nowadays with bullying becoming such a big issue in schools, self-esteem issues, and then of course the health concerns that are associated with it. What are some of the conversations that you have with parents about how to fight that?
A lot of the parents are concerned about their children being overweight and the stigma that does come with that. We talk to them a lot about getting physically active, getting away from the TV, trying to make sure their children are eating correct and nutritious and healthy so that they can keep the weight that they need to keep without becoming overweight. Healthy
lifestyle.
Yeah.
Kind of switching gears a little bit, Community Wellness Center does a lot and is a great resource for WIC services.
Correct.
Let's talk a little bit about WIC because it is a great service and a great resource for people from all walks of life. And you know, the Community Wellness Center again is a big facilitator of that. Unfortunately with WIC though, there is that stigma, and there shouldn't be a stigma because it is again a great resource.
Yes.
So tell us a little bit about how the Community Wellness Center works with WIC and the services that are available.
Okay, WIC services are available. It's based on an income level, or if you are qualified for Medicaid or food stamps, you will automatically qualify for WIC. It's a program where we feed children and postpartum and prenatal mothers, trying to establish with prenatal mothers good nutrition to help with a healthy baby. With the children, again, educating on good nutrition, eating healthy, different lifestyles, making changes to make their lifestyles better, healthier lifestyle, promoting exercise, getting away from the TV. Family events, go out and do family things.
Right.
So.
And you were talking back to WIC about that St. Tammany Parish Hospital is unique and that we're the only ones that are providing special access to WIC.
Correct. We do WIC at the bedside for the moms that are in the hospital so that they are not having to come into our facility. We will go to them and they won't have to come in with a brand new baby to the facility, and they're able to access their vouchers that they need for the food and the formula without having to come in right after having a baby. So.
Right. And again, WIC is something that I don't want to say everybody can use because there are income limits, but with the economy, it's definitely something that we're starting, not that it's super prevalent, but it is something that we're seeing.
We're seeing more and more people who would never have thought about using WIC coming and using WIC. Job losses, foreclosures on homes, those types of things. So they're coming in and using our facility and taking advantage of the program that's there for them to help to feed their kids.
Right. Well, now we're back in school. Kids are in and out. They're at school. They're in after school activities, extracurriculars. What are some of the things you're starting to see? What are some of the common threads that parents will bring their children in for?
Well, they're bringing them in, they bring them in to do the WIC process.
Right.
And so we're doing that education when they bring them in. A lot of times parents are too busy for certain activities, so we're talking about things to help them, after dinner take a walk.
Right.
Go to the playground, those types of things to try and help them with that. And then we have our nutrition classes that we do teaching healthy nutrition to try and help them with their busy lifestyles. We've had one of our subjects was fast food on the run.
Right.
When you're on the run, how to make the better choices. So we try and help them, as they get busier and busier, they have a harder and harder time preparing those healthy meals or finding a way to do healthy eating. So we kind of help them along, different suggestions to help them with that.
And we're going to share some of those programs on screen that the Community Wellness Center does offer. But if you can kind of give us a rundown, you mentioned Fast Food on the Run is a great program that we offer. What are some of the other things that we're working with the community on to get that information out there?
We do a lot of outsource outreach. We'll go to different physicians' offices, OB offices, and give information out there. Try and meet with their office manager to educate them so that they can educate the rest of the staff and then get the people in as well.
One of the things talking about nutrition is don't use food as a reward.
Correct.
What exactly does that mean?
If you're potty training, don't use your M&Ms. Try and do stickers or stamps. Don't, do the whole, if you do this, I'll give you a sucker, or if you do this, I'll give you a candy bar. Try and use other non-food rewards. Let's go to the zoo. If this happens, then we can go to the zoo, or just other non-food items, because you don't want to promote that. If I do this, I'll get this.
Right. I'm going to put you on the spot, and if you can't answer it, it's okay.
Okay.
What's the number one question you get from parents? What's the number one concern they're asking you about when they bring their children into the center?
They're mainly just concerned about how to help their children be healthier.
Mm-hmm.
A lot of people don't have the education, and that's what we're there to provide.
Right.
They grew up a certain way, and that's all they know. So they want to know, they want to learn, and we love to be able to teach that to them.
And one of the great programs that the Community Wellness Center does do is the Circle of Security program.
Correct. That's a fabulous program.
Which is all inclusive, and I believe it's a 16-week course.
Yes.
10 or 16 week. But we'll have more information about that. We're still taking names for it.
Yeah.
But that does cover kind of everything.
It does. That's a fantastic program, and every girl that has come through that program, they're crying when it's time to leave because they love it so much.
Yeah, I was just there for their graduation day for the last class, and you could really see where the bond had been strengthened between the mother or caregiver and the child.
Correct.
And like you said, it teaches them everything from nutrition to understanding their needs better,
Right.
and just really kind of making that connection stronger.
Yes.
So before we cut out, is there anything else about Community Wellness Center you think that we want to share, either related to WIC or as kids are back in school, and what parents need to know?
We do immunizations also at our clinic. I think that's been mentioned. We're getting a lot of kids right now who may be behind that are whipping in to get their immunizations. Those are available. WIC as a whole is just a fantastic program. I'm very passionate about it, which is why I work there. We have a great staff. And if you have any questions about the income, you can find it online, thewic.org, or you can call us, and we'll be happy to give you that information.
Okay, well, Sharon, thanks so much.
Thank you.
And thank you for joining us today. We'll see you on the next issue of Healthy Living.